And we mean every word of it, Richard. Every word. And Eva, as far as you're concerned, just let me say I've been watching you since you came to work here. And I've watched you develop from a coy little adolescent girl to a confident, mature woman with a brilliant future. A qualified, healthy female removing herself from the workforce for the dubious privilege of marrying the boss.
I'm not quitting work to marry Richard.
No?
I'm marrying him so I can quit work.
I thought it was love. All right, we'll drink to that, huh? Here you go, put your glass over here. All right, if that's settled, then tell us when. Tomorrow.
You talked me into it.
Well, that's when. Now, where?
Someplace quiet.
Ooh. Well, may I recommend the Saint-Beuve?
Where's that?
It's 2 blocks from the Louvre. Here.
2 blocks?
Open day tickets to Paris. Return if you're dumb enough to come back.
Billy, you are outrageous.
Oh.
And I love you.
Oh, it's all right. That's just gonna have to wait till you return. And Richard, I don't want to see your face in the city for at least another month.
That's beautiful, but I can't accept it.
Come on, get lost, will you? You know I can handle things around here.
I don't think. Thank you.
Hey, now, if I'd have thought that you were gonna break down.
Just remember the telephone call I gotta make.
Oh, no, nothing to it. Give me the details. Give me the number. I'll take care of everything.
You finish the champagne.
Dr. Hunter.
Oh, it's Richard Burrell.
Yes, Rich. Are you okay?
It's the worst one, Doctor. It's the worst one I've ever had.
When did it start?
It's been more than a minute. I've already taken the nitro. Can I take it?
Take it right now. Is this the first one today?
First one in months. I thought it might have stopped altogether.
I wish it worked that way.
I think it's subsiding.
All right, when it does, I want to see you over here.
Tomorrow morning.
Tonight. Breathe deep for me, Rich. Keep going. Okay. How was your night?
All right. No sleep. I kept waiting for the next jolt, but thank goodness, nothing.
Rich, I think we might be able to move you out of that knock on wood category.
Something better than nitroglycerin?
We think so. It's a surgical procedure. Have a seat.
Surgical?
We're about to begin a pilot project here. Team's flying in from Detroit. They're going to handle it until we can develop our own routine. We're going to do this operation in groups of 4. I'd like to include you in the first group.
What exactly?
Disabling angina attacks, the kinds you had yesterday, are caused primarily by a blockage of circulation. This operation creates a bypass around the blockage.
How complicated is this?
A lot more than an appendectomy, a lot less than brain surgery. Half a dozen centers around the country have been doing these very successfully for quite a while. In your case, Rich, I couldn't advise anything more strong.
How long would I be in the hospital?
Week to 10 days, if you pass the final test.
I thought I was a prime candidate.
You are. But we're going to have to do an angiogram first to get the total picture. Here, I'll show you what that is. See, the angiogram shows us how well the blood is flowing through these arteries in the heart. At this point, we don't know whether or not you suffered an infarction.
If I have?
It could be a minus factor, but we should do the angiogram in any case.
A week to 10 days.
Now wait. Weigh that time. Balance it against the rest of your life.
Maybe.
Maybe's the word.
I'll play.
Good.
If we are really going to take the whole month, why spend it all in Paris? When was the last time you had a baked fish dinner in San Sebastian?
It's been some time.
Right. And how about 4 days in Dubrovnik?
Why not?
The point is, we could use Paris as a base and then make a whole bunch of flying trips in all directions. Is that too ambitious?
Sounds spectacular. I love every minute of it.
I knew you would.
There's just one hitch.
You decided you don't want to marry me. Well, okay, then don't. I knew you'd come to your senses sooner or later. But we can take separate flights or something. Nobody'll know.
No, that's not funny.
You're telling me. You haven't had any second thoughts, have you? Anybody who got burned as badly as you were would have a perfect right to.
If he didn't love you as much as I do.
Nice. I approve of that. What's the one hitch?
We gotta push everything back about 10 days.
Everything? You mean the marrying part, too?
The marrying part, the Paris part, the Dubrovnik part, everything. 10 days, 2 weeks at the most.
Something to do with that phone call.
Yeah. You won't repeat this if you run into Billy, but I have a chance to sell a firm. A conglomerate is interested in it.
Do you want to sell it?
Well, the price they're bandying around, I'd sell anything, except you. Now, the problem is that I have to go to them, and they're in Dallas. And then from Dallas, they and I'll probably have to go to Baltimore to talk to him. Are you following any of this?
No.
Good.
When will you be going?
Well, I thought I'd go tomorrow. The sooner I leave, the quicker we can get back on schedule. Look, I'm not thrilled about any of it. But it gives you time to think, too.
Stop it.
Well, it gives you time to shop for some clothes and unload this apartment, both of which need doing, especially the second.
Paris is where you buy clothes, dummy. And what if I unload this apartment and you never come back from Dallas or Baltimore?
I'm coming back. I'm coming back.
Jack, suppose I arrange to have a chariot meet you at the airport. That way you can be pulled triumphantly down the freeway. Oh, we'll arrange to have some third-year med students and some candy stripers do it. All right, one standard limousine. Very prosaic. All right, Godspeed. My trio from Detroit is right on schedule. What about your quartet?
Right here. I think we have a fine cross-section to begin with, David.
We'll start the indoctrinations this afternoon, angiograms tomorrow, with surgery the following day.
Right. And here we go. Patient number 1, Don Capello, professional baseball player. Age 33, disabling angina attacks for the past 6 months, type 4 lipoprotein, some ST abnormalities in his EKG, normal glucose. Second, Gus Stegner, age 58, retired on disability pension 5 years ago, has a history of stable angina, slowly increasing in severity, referred to us by his family doctor after he failed to respond to a course of nitrate therapy. Third patient, Bert Watson, age 49. He's a building contractor, Unstable angina history for 3 years, elevated blood pressure and high cholesterol. Been on digitalis for the past year and has a poor glucose tolerance. And the fourth patient is Richard Burrell. He's 42 years old. He's a last-minute substitution for a more stable case that can wait till next week.
Time.
So it is. Here we go.
Paul.
Thanks.
Hi. Bert Watson.
Richard Burrell.
Hi.
Stay now.
Say, excuse me for asking.
I'm him. You're absolutely right.
Morning, gentlemen.
Morning.
Morning. Gentlemen, we might as well get right down to it. You're all here for the same reason. There's a real chance that we may be able to make your lives a little more worth living. And I'm here to explain exactly how. In 80% of the cases of crippling angina, there are one or more areas where the blood supply to the heart is choked off. What we do with the coronary artery bypass is to locate those areas and then build a detour around them.
It's a miracle what these guys can do.
I wish it were. Then we could make stronger guarantees. What we do have to work with at this point are a lot of good results, some high hopes, but unfortunately, no miracle.
No, I just meant that afterwards you could do just whatever you did before.
Many patients return to a normally active life. Many others show considerable improvement.
Some just shuffle off. Not to Buffalo either.
There is naturally some risk. The operation has a 4% mortality rate nationwide. We're going to be working with one of the top surgical teams in the country. But before they get here, there is one more step that we have to take. An angiogram of your coronary arteries. We make high-speed x-rays of your heart's arteries to show where the blood is actually flowing and where it's blocked off.
The x-rays, I was wondering.
Now, it's not just a simple chest x-ray. The angiogram involves injecting opaque fluid into the heart's arteries to see exactly where the circulation is.
Into the heart? That's safe?
Well, naturally, there's always some risk when you insert a catheter into the heart. But you don't have to submit to the angiogram. Of course, we can't do the operation without it.
I'm in.
Good. These forms will show you exactly what the procedure for the angiogram involves. Naturally, I'll answer any questions you may have. The bottom page, by the way, is a release signed form if you so choose.
Why don't you give out the other form at the same time?
So the one to authorize the surgery?
No, the one to authorize the autopsy.
Hey, Gus, gonna eat your dessert? That pudding there?
That's what it is?
Yeah, it's good. Don't you want it?
You take it. With my blessing.
Thank you.
The condemned man ate.
There you go again. I don't know. Haven't you guys read up on this operation? It's fantastic.
Obviously, you have.
For the last 6 months. They got it taped, I'm telling you.
Will you go to sleep or something?
You asked, I'm telling you.
My mistake.
I'm gonna go buy a magazine.
So, your ball club, how they doing?
Without me.
Fine. It's only the mating dance. We haven't got down to business yet. No, I don't know which hotel I'll be staying at. I'm calling from their office right now. Baltimore is still a possibility. It's not definite. It depends how the next couple of days shape up. How are you? That's lovely. Yeah, well, keep the thought. I'll call. Bye.
Nobody's supposed to know, is that it?
Yeah,
Thanks,
that's it.
Sandy.
There's no law against it, is it?
It's nothing to be ashamed of.
It's something I don't want her burdened with. You haven't met her, you wouldn't understand.
Maybe she would understand if you...
Do we have to talk about it?
See you tomorrow.
Right now.
Loaded and ready, Paul.
All right, Harry, we're all set here, and we're counting. 3, 2, 1, now. Injecting dye. How are you feeling, Don?
Is it over?
Almost. We'll take this catheter out. We've already shot the picture.
Pictures.
Readings all check out, Paul. I think we got it.
Good, Harry. I'm gonna close you up now. Reload for Burrell. After we do him, we'll wrap it up. How you feeling, Rich?
My arm kind of tingles.
Well, that's normal. Nothing to worry about.
Ready when you are, Paul.
We're all set. And counting. 3, 2, 1, now. Injecting dye. Defibrillating. Harry, give me a hand. Breathing. Give me intracardiac adrenaline. Get the defibrillators ready. Right, set 200. Reset, back. Ready? Hit it. Come on. Come on, Rich. Not responding. Let's go to 300. Ready? Set. Hit it. Oh, come on, Rich. All right, let's go to 400. Set. Hit it. Come on, baby. Come on. Come on, Rich. Yeah. He's holding. Back it off. Pulse?
Holding at 70.
Blood pressure?
90 over 50.
Okay, close him up. Let's get him up to ICU.
Looks like we got our pictures before the trouble started.
Good.
Hello.
Hi.
Hello.
Hello, hello.
I ran into Mr. Newman. He says to tell you he misses the chess game.
He misses getting beat?
Well, he says he brought the book of the Fischer-Spassky match, and when you get home, you can replay the game.
Which one do you suppose he wants to be?
Oh, Walter dropped in the other evening to see how you're getting along.
Also to see how you're getting along?
Maybe.
Well, you'll soon be rid of me. You can do whatever you want.
All I want is for you to get well and not to be in bed all the time.
I'm used to it.
How many are you planning on for the evaluation?
We'd like to get 40 through surgery. That'll give us an adequate sampling for follow-up studies.
We're prepared to do surgery every third day. That way we don't overload the intensive care ward.
That brings us down to this one.
What do you think, Jack?
I wish I could say something hopeful about it. How are the A-series pictures, Charlie?
Oh, advanced three-vessel stenosis, significant heart enlargement, left ventricular scarring.
No, sir. No way. Well, to sum it up, Capella and Stegner are beautiful. Mr. Burrell is a little bit higher surgical risk than we anticipated, but I'd recommend. Mr. Watson does not qualify.
No miracles. There are too many factors against it. The extent of your heart disease, your previous attacks, even your family history.
But you knew all that stuff before I got here.
We knew part of it, Bert. We didn't know enough until the angiogram. Your heart shows ventricular scarring from earlier attacks.
Doc? That's a death sentence you're giving me.
No, sir. What I'm telling you is that this operation won't help you, but we have other ways of treating your disease.
Like what?
There's a drug called propranolol that's showing good results.
Will it cure me?
Unfortunately, Bert, nothing we know of will do that. But we may be able to cut down on your pain and increase your level of activity.
For a while.
Perhaps for quite a while.
Do me a favor, Doc.
Sure.
Don't put me back in there with those other guys.
As a matter of fact, I'd like to move you to a medical ward and start you on the propranolol program right away.
So one time I won't do any reading up on it.
Let me show you to your new room. We'll have your things sent down. Hi, Rich. Hi. Hey. We're going to move you back to the ward. Your EKG's looking good. But, we've got a decision to make. That episode this morning told us one thing. The surgical risk is increased.
It was 4% for openers. What's it now? 25, 50%?
That's the area, yeah. On the other hand, the way your pattern is shaping up, you could have a worse heart attack within 6 months. An outside figure would be 3 years.
Let me put it in layman's language for the both of us. Richard Burrell is 50-50 dead if he goes on that operating table tomorrow morning. And he's 100-0 dead if he doesn't. But maybe not in 6 months. On that, I base my decision.
With a few refinements, you've said it.
6 months. There was a time you could have scared me with a prediction like that. But now, maybe I should take the sure thing.
Sure thing. Rich, the only sure thing is that your condition's going to get worse.
Oh. No. I was supposed to get married again. Day before yesterday, as a matter.
To that lady who thinks...
I'm out of town on business.
Don't you think it's about time she knew about this?
No, I don't. I got married very young the first time. Younger than Eve is today, as a matter of fact. And my first wife was no Eve Tanner, not in 1,000 light years. And maybe that was partly my fault, but as the saying goes, who cares? I did my time, 17 years, 2 kids. It was a nightmare for all of us. So I bowed out, I cleared out. I didn't fight for the kids, I didn't fight for money. I tripled my workload, and I made it all the way. I wasn't happy. I was lonely. And then Eve came to work for me. She turned that whole thing around, you know? So, you understand what I'm saying? 6 months, for sure. Well, that's 6 months I didn't think I'd have. Maybe it's better to take that than a even chance of nothing tomorrow morning.
Rich, you're a fool if you don't go on that table tomorrow morning.
But a happy fool. There's something to be said for that.
You've heard my recommendation. All right, we're going to move you back to the ward. You've got tonight to think it over.
Thanks.
Get some rest.
Saving electricity? Man could hurt himself. I just heard about Burrell.
What do you think?
Well, I guess there are worse ways of losing a patient.
That's exactly what this feels like.
It's not a choice we could make for him. He's over 21.
Then why'd he run away? Sneak away? Like a scared kid? Now, if he couldn't make a mature choice, David, maybe I didn't present it properly.
I don't like to see you second-guessing yourself.
Maybe I was too graphic. Maybe I wasn't positive enough about the surgery yet.
What are you going to do about it? Sitting here in the dark like a tulip bulb waiting for springtime isn't going to change anything. How many times do you lose a patient you can't get back?
You think I ought to take a shot at getting him back in here?
You're going to be less than useless to all of us if you don't take a shot at it.
Thanks, David.
Sounds like heaven. Will you? Thank you, Michael. We'll be right here. I was going to check into that new craft train that's supposed to run between Carcassonne and Barcelona. Now, will you please tell me what happened?
Well, enough of anything happened. I found myself wasting days sitting around in hotel rooms. And I could have been in Dubrovnik or anywhere with you. I said, this is stupid. If they want to buy the firm, they can bloody well wait. And if they don't, well, it's not the end of the world. So I took the first plane. I'd even seen the movie, but I toughed it out.
I love you.
That doesn't hurt either.
I can't imagine.
Another item from your sordid past?
If it is, I hope he's brought some bubble gum.
Miss Tanner?
Hello.
I'm Paul Hunter.
Not for my sordid past.
No, from mine. Come in, Paul.
Thank you. Thanks.
Paul's my doctor.
Oh, we've had the blood test. Can I get you something to drink?
Love some, thank you. How about that much of anything alcoholic? Scotch, you got it?
Done.
Thank you.
Something important, Paul?
Could be. Just double checking, really.
The status is quo.
So it seems.
Here you go.
Thank you. Well, I guess a toast to the future's in order.
Okay.
Yes, please.
To the future.
We're going to Paris the day after tomorrow.
You left out a step.
You're getting married tomorrow.
Oh, yes, that's right.
Right. Can you come? It'll just be in an office.
Thank you. I wish I could.
That's Michael about the train. Excuse me. Hello? Oh, fabulous. Now, look, here's what I wanted to ask you about before. Let's say you wanted
Status
to get
quo?
to San Sebastian while it was still daylight. Does that
That's
road
as happy as she
go
can be.
away? It does.
That's as happy as she's ever going to be in
Well,
your lifetime, maybe in hers.
Suppose there were a way to get from Venice to Dubrovnik by water. Besides snorkeling, don't bring up the past, Michael. It's over. No. Seriously, what I'm trying to figure out is if we could...
Michael, Richard Burrell. We'll call you right back. Honey? Paul has tracked me down because he wants me to undergo a very tricky heart operation tomorrow morning. It's to correct a blockage of an artery that could kill me in a short time.
You weren't in any Dallas?
I was in a hospital. Craig Institute. And I was going to have the surgery until they found out what the risk would be.
Why didn't you tell me?
Now that he has told you, I'm going to say something, and then I'm going to go. Rich, the coronary bypass is the best chance you have to live out your years. You could die. That factor's unremovable. Without it, you will die. Tragically. Because it's always a tragedy when a human being dies even 1 second sooner than he should, let alone 20 or 30 years. Nice meeting you, Miss Tanner. I hope to see you both tomorrow. Excuse me.
Why did you do all that lying?
Because I didn't want this to have anything to do with us. I thought 6 months, a year, what we have going
Would be enough. For you. And what about me?
I wasn't sure. I'm just stuck with a sick man.
One day, you would have just up and died on me. What'd you think I'd do? Shrug it off? Call the insurance company? I wish we were already married. For one reason only, so I would have the undisputed right to break something over your head.
Sorry.
No, don't be sorry. Just give me your car keys.
Why?
Because I am driving you to that hospital, and you are going to have that operation, and we are getting married. And we are going to fly to Paris, and thence to Dubrovnik and other points of interest. But it starts with the car keys.
Oh, Brian.
Hi. Do you know where the waiting room is?
I can't figure it out.
What's that?
For 5 years of pain, my father was an absolute angel. He never complained. He never made any demands. Ever since I came home with a magazine article about this operation, he's been like this.
Well, maybe he never demanded anything because he never had to. I mean, maybe he got to like it, pain or no pain.
What do I do with him afterward?
Well, I think it's very simple. Don't change a thing. Just, you wait on him hand and foot, spoon feed him, give up your life for him. You'll get your angel back.
Wouldn't that be the worst thing? Oh, you wise guy.
Why don't you relax? I'll see you later.
We'll bridge this occlusion with a saphenous vein for an immediate blood supply. Take out the vein. Turn on the cautery. One down, 2 to go.
You make it look easy, Jack.
It's the first couple of hundred that are hardest. Actually, he was the easy one. From now on, we really work.
We're ready for you now, Mr. Burrell.
There are two areas of trouble. There's a block in the circumflex here and a block in the right coronary. We'll bridge them both with saphenous veins. Take out the vein.
Careful.
Turn around the quarter.
Spanish.
Quinn, give me the sternum spreader.
Suture.
Miss Stegner, please come with me.
Turn on the pump. Give me the fibrillation wires. In some ways, we're in the most important crisis right now. There's always some internal bleeding, losses around 400 cc's. When it gets to that calibration, it should be pretty well leveled off. If it reaches 1,000, we're in trouble. We'll have to go in again. Stegner seems to be leveled off.
Capello seems to be.
Dr. Hunter.
Jack. Burrell's post-op bleeding's out of control. He's hemorrhaging too fast. Bring that gurney back. Larry, set up your anesthesia. Emergency on Burrell. Wendy, call alert OR. Type and cross into 10 units of blood.
Knife. Suction. Wire cutters. Sternum pad. Sponge that area on the right, Charlie. God, it's not the bypass graft.
There's a small bleeder near the anastomosis.
Give me a Townsend pipe.
What's the prognosis on one like this?
That's uncertain. We need another angiogram, but I don't want to catheterize him for at least a week. Give that artery a chance to have a little rest and peace.
Weak.
Well, it may not be the easiest week in his life, but it'll certainly be the most important.
How you doing, Gus? Hang in there. Don, you're looking good. We're going to kick you out of here in a couple of days.
Then what?
Go back to living your life?
How?
You mean, can you go back to playing baseball?
Right.
Don, this bypass enables a man like yourself to live a normal life. You want to go back to being a professional athlete.
That is my normal life.
I know. You know what kind of stress you put your heart under every time you... What? Trying to score from second on a scratch single, or you...
Then you're telling me I'm out of that line of work.
What's more important, Don? Playing baseball or living? Can you stay in baseball and not be a player?
So what exactly did you give me for my $6,000? 5 more years in the league was what I asked for. That I can forget. A normal life I haven't had since I was signed out of high school. So what's left? Coaching? Scouting?
Are they such horrible prospects?
Didn't say that. Maybe not. What do I say? Thank you, I think.
Don't say anything. Just call me in 5 years and fill me in, okay?
5 years. Maybe by that time it'll make sense.
Kill the umpire. Suppose he makes a mistake. I don't understand.
Looks like you're getting out.
Yeah, I just thought I'd come up and say goodbye.
You look pretty good.
Hey, I'm getting along. They're giving me some kind of stuff. I can't even pronounce it. But it seems to be working. It cuts down on the pain. Say, you going to win the pennant?
Not a chance. No depth. And I get mattered. So how long are they gonna keep you on that stuff?
The rest of my life? Maybe a couple of years. Hey, you guys take care of yourselves, okay? I'll see you around.
Me?
Poor man. You know, we're really lucky.
How you feeling?
You tell me.
Can you stand some good news?
Try me.
Your post-op angiogram shows 2 things. Your circulation is fully restored, and that ruptured artery is mending nicely.
But?
No buts. It was a little more complicated than we expected. Do you want the truth? You're not going to have any more chest pain. In fact, you'll probably outlive us all.
Doctor. Thanks for the house call.
Good morning, gentlemen. You're all here for the same reason. There's a real chance that we can make your lives a little more worth living. And I'm here to explain exactly how. In 80% of the cases of crippling angina, there are 1 or more areas where the blood supply to the heart is choked off.